Hi, I'm Stella Herrera-Williams, and welcome back to Navigating Senior Care with Stella. September is World Alzheimer's Month, and this topic is incredibly personal for me. As someone who spent years helping Austin families navigate senior care decisions, you'd think I would have recognized the early signs of dementia in my own mom. But here's the truth. Being a professional doesn't make it easier when it's your own family. Today, I want to share what I've learned about dementia, both from my professional experience placing families in Austin communities and from my very own personal journey with my mom. Because if my story can help even one family recognize the signs earlier or feel less alone in this journey, then it's worth sharing. First, let's talk about what dementia actually is. Dementia isn't just one disease. It's an umbrella term for several different conditions that affect memory, thinking, and daily functioning. The most common type is Alzheimer's disease, which accounts for about 60 to 80% of dementia cases. But there's also vascular dementia, Lewy body dementia, and frontotemporal dementia. And each one can present differently. Now, here's what I wish I paid attention to with my mom. The early signs aren't always obvious. We think of dementia as forgetting names or getting lost, but sometimes it starts much more subtly. With my mom, it started with her losing items constantly. We'd spend hours looking for money, remotes, glasses, her teeth. Yes, her teeth. I thought she was just getting older, maybe more forgetful. Then I started noticing she was doing things way out of the ordinary. Little things, but strange, like finding raw meat stored under the counter in the pantry where the pots and pans go. She'd pay the same bill twice or forget to pay one at all. As her daughter, I made excuses. She's stressed, she's distracted, she's just getting older. But as a placement advocate, if a family had called me describing these exact same behaviors, I would have gently suggested they talk to their mom's doctor about a cognitive assessment. Other early signs to watch for: changes in judgment or decision making. Maybe they fall for scams they would have easily spotted before, or they start making uncharacteristic purchases. Difficulty completing familiar tasks. This might look like struggling to follow a recipe they made 100 times. For my mom, it was her arroz con pollo and tortillas. Dishes she made perfectly for decades, or getting confused about games like bingo that she's played for years. Changes in mood or personality. This was big with my mom. She became more suspicious, more anxious, less patient than she'd ever been. Problems with language, not just forgetting words. We all do that. But struggling to follow conversations or repeating stories within the same conversation. Sometimes they'll even mix two different stories together, creating confusion about what actually happened. Here's what I tell families now, and what I wish I'd told myself then. Trust your instincts. If something feels different about your loved one, it probably is. You know them better than anyone. And here in Austin, we're fortunate to have some excellent resources. The Alzheimer's Association Greater Austin chapter offers support groups, educational programs, and a 24/7 helpline. Dell Medical School has a comprehensive memory care program. And many of our local senior living communities, like the ones I work with through Tour Senior Living, have specialized memory care units with staff trained specifically in dementia care. But the most important thing I've learned, early diagnosis matters, but so does early support. Not just for the person with dementia, but for the whole family. I spent months feeling guilty that I missed the signs, that as someone who supposedly knows this field, I should have seen it coming. What I've realized is that love sometimes makes us blind to the things we don't want to see. If you're listening to this and thinking about your own parent or spouse, trust those instincts. Make that doctor's appointment. Ask the hard questions. And know that whatever comes next, you don't have to figure it out alone. In our next episode, I want to share something else with you. A health challenge I faced that completely changed how I approach caregiving, both professionally and personally, because sometimes the caregiver becomes the one who needs care. Until then, this is Stella Williams. If you're navigating this journey, remember, you're doing better than you think, and you're not alone. Subscribe wherever you listen to podcasts, and thank you for being here.